Hey everyone, welcome back to our channel. Today, we're talking about something super important, fatty liver disease. It's when too much fat builds up in your liver and can cause some serious problems. But don't worry, we've got some simple tips to help manage it. First off, there are two main types of fatty liver disease. One caused by drinking too much alcohol, and the other not related to alcohol at all. The second type, called non-alcoholic fatty liver disease, NAFLD, is the one we're focusing on. NAFLD usually doesn't show symptoms and is often found by chance when doctors check the liver for other problems, like high liver enzymes. To diagnose NAFLD, doctors do blood tests to check liver function and look for other issues like hepatitis or celiac disease. They also use special scans like ultrasound or MRI to see if there's any damage to the liver, and sometimes they might take a tiny piece of liver tissue to be sure about the diagnosis and see how bad the damage is. Now, what causes NAFLD isn't totally clear, but things like being overweight, having diabetes, high cholesterol, or high blood pressure can make it more likely. So, if you're dealing with any of these, it's important to pay attention. So, what can you do about it? Well, here are some simple lifestyle changes that can really help. 1. Lose some weight. Even just a small amount of weight loss, like 3 to 5% of your body weight, can make a big difference. 2. Try the Mediterranean diet. This means eating lots of fruits, veggies, nuts, and healthy fats like olive oil. It's been shown to help reduce liver fat. 3. Beetroot juice. It has long been used as a natural solution to boost liver enzymes and enhance bile production, which aids in the liver's detoxification process. It contains betalains and various other compounds known to lower inflammation, shield against oxidative stress, and decrease the likelihood of liver injury. 4. Drink coffee. Yep, you heard right. Coffee can actually help protect your liver. Just don't overdo it. 5. Get moving. Being active, like going for a walk or playing outside, can really help improve your liver health. 6. Cut back on sugary foods. Too much sugar can be really bad for your liver, so try to avoid things like soda, candy, and baked goods. 7. Watch your cholesterol. Eating less fatty meats and processed foods can help keep your cholesterol in check, which is good for your liver. 8. Consider omega-3 supplements. These healthy fats, found in things like fish and nuts, can be really good for your liver. 9. Be careful with alcohol and medications. Both can be hard on your liver, so it's important to use them in moderation. 10. Talk to your doctor. They can help you figure out the best plan for managing your NAFLD and may recommend things like vitamin E supplements or certain herbs. Keep learning about NAFLD and how to manage it. The more you know, the better you can take care of yourself. Remember, managing NAFLD is all about making small changes over time. So, don't get discouraged if it takes a while to see results. Just keep taking care of yourself, and you'll be on the right track. Thank you for watching this video. Please like, comment, share, and subscribe for more videos on psychology and health.